So good morning, everyone. Thank you, APAO, for this opportunity. So the title of my study is Characterization of Peters Anomaly with Glaucoma, Clinical and UBM Perspectives. Coming to the background, as we all know, Peters anomaly is characterized by a shallow anterior chamber, synechia between iris and cornea, a central corneal opacity, and defect in the descent membrane. It has been classically subdivided into type 1, type 2, and Peters plus, and these are the known genes that we know of as of yet. So UBM is a high frequency ultrasound which visualizes anterior segment in opaque corneas, and a definitive diagnosis of a posterior descent defect is possible only by UBM. And studies have found high degree of consistency between UBM images and histological diagnosis in congenital corneal opacities. So our research question was, what is the clinical profile of Peters anomaly, and is there a prognostic value of UBM characteristic at presentation? Our aims were to describe the clinical profile of patients with Peters anomaly presenting over a 5-year period, to characterize and classify the various UBM findings in Peters anomaly, to correlate surgical outcome of patients with 1-year follow-up with the UBM findings at baseline, and to study the genetic profile in those undergoing genetic testing to assess the genotype-phenotype correlation. So ours was a retrospective cohort study over a 5-year period. We included children who had a congenital corneal opacity with a central clear area, presence of a descent defect on UBM, which was done using an open shell technique under general anesthesia, and following data was collected. The glaucoma outcome was graded as good, fair, and poor depending on the glaucoma control. So our outcome measures were as follows: demography and clinical features of Peters anomaly, UBM patterns of Peters anomaly, correlation of clinical and UBM pattern at baseline to the surgical outcome at 1 year. Coming to the results, so we had total of 21 children, that is 32 eyes over a 5-year period. The mean age of presentation was 1.31 months and the mean follow-up duration was 33 months. Coming to the laterality and gender, 48% of the cases were unilateral and 52% were bilateral, while 10 were females and 11 were males. So, over a 5-year period in 32 eyes, we noticed 4 distinct UBM patterns of Peters anomaly. So, type A was only descent defect, where there was only a descent defect present. Type B UBM was descent and a posterior stromal defect. Type C was descent stromal defect with iridocorneal adhesions, and type D was a descent stromal defect with corneolenticular adhesions. So these were the 4 types that we noticed over a 5-year period in 32 eyes of Peters anomaly with glaucoma. And coming to the different presentations, type A was the most common, constituting 47% in our study. Type B was 34%, type C was 16%, and type D we only had 1 eye with corneolenticular adhesions. Coming to the follow-up results, we can see that the cornea clarity, intraocular pressure, and number of anti-glaucoma drugs decreased significantly at 1 year after surgery, while there was a significant decline in corneal thickness on UBM. The p-value was significant. We also did optical iridectomy in 15 of these eyes, and the eyes with optical iridectomy had a better visual acuity than eyes without optical iridectomy, but the p-value was not statistically significant. The glaucoma outcome at 1 year was graded as good, fair, and poor, with 25% of eyes having good outcome, 47% having fair outcome, and 28% having poor outcome. Coming to the correlation, when we correlated the type of UBM with the glaucoma outcome, we can see that the type A UBM had the best glaucoma outcomes, with 13 of the 15 eyes having good to fair outcome, followed by type C, which had similar results, and type B, which had the worst outcomes, with almost 50% of the patients having poor outcome. Genetic evaluation was done in 16 of these eyes, and we found 9 pathogenic variants with CYP1B1 mutation dominating the cohort. So to summarize, our study was one-of-a-kind study characterizing Peters anomaly with glaucoma. We classified UBM into 4 different types, with type A having the best outcomes and type B having the worst outcomes. Overall, 72% of the eyes had good to fair outcome in our study, and there was significant decline in corneal thickness after surgery. Peripheral optical iridectomy offers some visual rehabilitation in these children, and CYP1B1 mutations dominate in the North Indian cohort of Peters anomaly. So to conclude, this study provides novel insights into the UBM characteristics of Peters anomaly and helps in better prognostication for affected patients through UBM-based classification. Thank you.
Dr. Shrishti, meanwhile, you can set yourself up on the other podium. Yeah, any questions?
Beautiful presentation. How many of them did you see were Peters plus? You had said unilateral, 58% were bilateral. How many were Peters plus?
There were 2 children and 3 eyes of Peters plus.
How was their prognosis different from the others?
We did not look specifically at the prognosis, but we graded
So
the glaucoma outcomes. So,
okay, so the Peters plus had which type of UBM characteristics? Is the DM for defect or the stromal and or
Desmet plus stromal.
plus stromal.
All 3 had Desmet plus stromal. Yes.
So just 2 out of the 32 eyes were Peters plus.
3 eyes and 2 patients. Yes, ma'am.
So the single surgery, they were subjected to the same surgery, all of them?
Yes, sir. Sir, the surgery was depending on the cornea clarity. So since Peter's children usually have a bad cornea, so most of the children underwent a combined trab with trab. But in 2 eyes, we were able to manage an angle-based surgery, goniotomy, when there was a peripheral clearing and we can see the angle. So all other eyes underwent a combined trab with trab.